University. We're joined ahead of the president's announcement by Dr. Perry Wilson, who is an associate professor of medicine at Yale. Welcome, Dr. Wilson. You saw that before we talk about any of the studies which Joe went through, that chart that he showed at the end, 1 in 31 versus 1 in 150 in 2000, no doubt that the autism rate among children in the United States has gone up. What are your own thoughts when you look at the data about the reasons for that? All right.
I'm sorry. There's been pretty extensive analyses of this increase in autism rates, and the general consensus is that we are much, much better at diagnosing autism. We have better early diagnosis and early testing in kids than we did 20 years ago. So a big chunk of this is simply due to the fact that a long time ago, we missed a lot of kids with autism, especially those with relatively mild symptoms. This is not to say that there is no environmental causes of autism, but the majority of the increase we see is because we're just better at picking up on it.
When you look at that, and I have it here again, just some bullet points on the tablet from the Harvard numbers that was put together by Harvard that Joe mentioned there. They looked at a bunch of studies. 46 of them, 27, showed links between the two. In this set of data, 9 no significant link, 4 negative links was the 100,000 participants overall. What do you say to that?
Well, I think one of the big themes we need to listen for about this announcement is the difference between correlation and causation. Okay. There are a lot of reasons pregnant women might take Tylenol, not the least of which being having a fever. And so it may be that having a fever when there's a developing fetus in the uterus increases the risk for autism. And there are many, many more reasons that are difficult to control for in these types of studies that people may take Tylenol: chronic pain, other medical conditions, even things related to socioeconomic status, access to healthcare, and so on. When you account for those things, one of the best studies I've seen is a study out of Sweden which looked at siblings, where one of the siblings was exposed to Tylenol in utero, the other was not exposed to Tylenol, and there was no difference in the rates of autism between those kids when you accounted for siblings, which means, by using sibling matching, you sort of account for all the parental factors that could go into this. And so this data is much more correlational than causational. Hopefully they're clear when they discuss that. Okay. Correlations are interesting, but we are always looking for causes at the end.
On that point about the Swedish study, I have that here as well. I believe the one you're referring to, it's a large study. Looking here at, well, autism, ADHD listed there as well, exposed versus not exposed. As you see, you don't see much difference there. And then to your point, finding no causal relationship between acetaminophen and autism. This is interesting, though, that mothers who have a genetic predisposition for autism and ADHD associated with greater pregnancy pain, Dr. Wilson, so headache and migraines. So I guess that's a chicken or egg question, that they may be more likely to take a painkiller like Tylenol.
Well, exactly. We have to think that Tylenol could be just a marker of something else, like headaches, for example, and that's the actual thing, or headaches is a symptom of some other actual thing that is leading to autism risk. And so I hope that the White House and HHS is very careful in their language and use terms like links or is associated with, which are terms that we talk about when we think about correlation, as opposed to causes, because we may actually, if we say Tylenol causes autism and women stop taking Tylenol during pregnancy, well, maybe they have more fevers. Maybe these things get worse, and it could actually worsen the outcome.
When you look at, or you're speaking to parents about this, and there's maybe some that are hopeful today. They want so badly to hear something that's going to help their families. Others maybe that are confused by hearing different messages from different people. In fact, at the White House today already, they talked about some of that. Here's the press secretary, Caroline Leavitt, at the briefing. Let me play a clip.
I think women for many years, in fact for decades, Ed, have been confused by the rapid increase in autism in this country. In the childhood epidemic, that is chronic epidemic, disease epidemic that is plaguing America's youth. Women are confused about that, and they want answers to that. And that's exactly what this administration is focused on finding.
Okay, and again, we'll see what exactly they announce, and to your earlier points, how they announce it. But what would your message be to parents today?
We're all concerned about that. I'm a parent. I remember being concerned about my kids. We all think about our kids, and people see the rise in autism rates and they want an explanation. So do I, and I think investing in good science to find those explanations is valuable to all of us. My gut feeling is it's not going to be Tylenol. One of the reasons is simply that it's not like we've seen a massive increase in Tylenol use in pregnancy over the past 20 years as we've seen a rise in autism. If anything, Tylenol use in pregnancy has probably gone down a little bit over that period of time. Secondly, even if you want to believe the studies, the correlational studies, and interpret them as causation, the numbers are still relatively small, which means that acetaminophen won't be the explanation for all cases of autism, but only a very small fraction, even if you think it really is causal. It means there's still more to look for. And we shouldn't despair about that. We should simply embrace it and say this is what funding for medical research is for, to find these answers.
Dr. Perry Wilson, thank you, sir, from Yale today.